The CDC director appeared before a Senate committee and emphasized the importance of wearing a mask.
I might even go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will.
On the subject of a vaccine, Redfield said one could become available before the end of the year, but only in a limited supply.
If you're asking me when is it going to be generally available to the American public so we can begin to take advantage of vaccine to get back to our regular life, I think we're probably looking at late second quarter, third quarter, 2021.
But the president publicly disagreed with the CDC director on the issue of masks and the timescale for an available vaccine.
No, I think he made a mistake when he said that. It's just incorrect information. And I called him, and he didn't tell me that, and I think he got the message, maybe confused.
The president maintained the release of a vaccine is imminent.
We're ready to go immediately as the vaccine is announced, and it could be announced in October, could be announced a little bit after October. But once we go, we're ready.
Presidential candidate Joe Biden says he would side with science rather than trust a president who he says has frequently misled the public.
One thing is certain, we can't allow politics to interfere with the vaccine in any way. Americans have had to endure President Trump's incompetence and dishonesty when it comes to testing and personal protective equipment. We can't afford to repeat those fiascos when it comes to a vaccine, when it occurs. The stakes are too high.
President Trump has made no secret of the fact that he wants a vaccine in circulation before the November election. He's repeatedly expressed anger at restrictions imposed on his campaign by the virus and is now back to holding full-scale rallies with many, including the president, rejecting the use of masks. Final clinical trials for potential vaccines have only just begun. They involve tens of thousands of patients, and importantly, at least 2 doses have to be administered over a period of time. It's impossible for the test to be completed in the timeline envisioned by President Trump, which raises a question of whether the president is considering cutting short protocols for the testing of new vaccines that have been established for decades. Hanna, Al Jazeera, Washington.